Colic is characterized by rule of three. It occurs in healthy, thriving infant beginning in the second or third week of life, lasts about 3 hours a day, occurs 3 days per week, lasts more than 3 weeks, and resolves by 3 or 4 months of age. It is equally common in breastfeed and bottle-feed infants. Although all babies have crying episodes, colicky babies cry excessively and are difficult to settle. The fussiness is not associated with hunger or any other form of discomfort. The cause of colic is unknown. Some believe it is due to gastrointestinal discomfort like intestinal cramping. Diagnosis requires ruling out other possible causes. Colic affects up to 40% of babies. It is most common at 6 weeks of age and typically goes away by 6 months of age. It rarely lasts up to 1 year of age. The cause of colic is generally unknown. Fewer than 5% of infants who cry excessively turn out to have an underlying organic disease, such as constipation, gastroesophageal reflux disease, lactose intolerance, anal fissures, subdural hematomas, or infantile migraine. Psychological and social factors have been proposed as a cause, but there is no evidence. Colicky babies may be more reactive to the same stimulus and cry louder than other babies. Mothers are at high risk for postpartum depression if they report inconsolable crying episodes lasting more than 20 minutes. Depression may lead to cessation of breastfeeding. The risk of abuse increases as parents may use aggressive means to quiet the child, resulting in shaken baby syndrome. The importance of implementing a series of calm, systemic steps to soothe the infant and having a plan for stress relief such as time out for parents and substitute caregivers. Parents can be advised that colic is self-limited with no adverse effects on child. Most importantly, parents are reminded that it is better to allow the baby to cry than engage in shaking that leads to head trauma. The sleep environment should be free of stimulation. Swaddling, rocking, white noise and movement, for example stroller, car ride, help some babies to settle. Infants who are carried by parents show different physiologic changes than when held in sitting position, although there is no evidence that continuous carrying is effective in colic management. A study in hunter-gatherer society shows that children who are continuously carried by their mothers display similar crying periods as those in Western societies. Some studies have found differences in fecal microflora between babies with excess crying and controls. Results include fewer bifidobacteria and lactobacilli, and more coliform bacteria such as Escherichia coli. If the child appears to have gastrointestinal symptoms, breastfeeding mothers may try elimination of milk, beans, and cruciferous vegetables. In allergic families, mothers may try stricter elimination of food allergens. For example, milk, egg, wheat, nuts, soy, and fish. Also, nutritional status should be monitored. For formula-fed infants, changing from milk-based to soy-based or other lactose-free formulas had no effect in most studies. The protein hydrolysate formula may moderately improve symptoms. Early studies of probiotics look promising, but evidence is insufficient to recommend their routine use. Certain herbal teas, sugar solutions, gripe water containing herbal supplements, and fennel extract may have benefit, but the evidence is weak. Baby massage may be helpful. Calming measures may be used and include soothing motion, limiting stimulation, pacifier use, and carrying the baby around a carrier. Although it is not entirely clear if these actions have any effect beyond placebo. No medications have been found to be both safe and effective. Simethicone is safe but not work. Disclomine works but is not safe. Average babies cry 2 hours per day, peaking at 6 weeks of age, and it is part of normal development. The peak period of infant crying usually occurs in the evening and early part of the night. Excessive crying or fussiness persisting longer than 3 to 5 months may be associated with behavioral problems in an older children, anxiety, aggression, hyperactivity. Acute onset uncontrollable crying could be caused by a medical condition. Potentially overlooked conditions to consider include corneal abrasion, tourniquet effect of hair wrapped around a digit or penis, occult fracture, urinary tract infection, acute abdomen including inguinal hernia, or anomalous coronary artery. Red flags indicating that further investigations may be needed include vomiting, change in stool, abnormal temperature, irritability, lethargy, poor weight gain. Problems to consider when the above are present include infections, intestinal pain, trouble breathing, increased brain pressure, skin pain, mouth pain, kidney pain, eye pain, overdose, and other symptoms.